Faye Abdellah 21 Nursing Problem Nursing Series.
Biography of Faye Abdellah, March 13, 1919, February 24, 2017, the first nurse officer to rank a 2-star Rear Admiral, the first nurse and the first woman to serve as Deputy Surgeon General. May 6, 1937, the German hydrogen-fueled airship Hindenburg exploded over Lakehurst, turning point. She would never be powerless again to assist when people were in need.
Nursing diploma from Pitkin Memorial Hospital School of Nursing. She earned 3 degrees from Columbia University. Bachelor of Science in 1945, Master of Arts degree in Physiology in 1947, Doctor of Education degree in 1955.
Abdellah's typology of 21 nursing problems. This theory interrelated the concepts of health, nursing problems, and problem solving. Major concept of 21 nursing problem. She defined nursing as service to individuals and families, therefore to society. Furthermore, she conceptualized nursing as an art and science that molds the attitude, intellect, competencies, and technical skills of the individual nurse into desire and ability to help people, sick or well, and cope with their health needs. She formulated 21 nursing problems based on review of nursing research studies. She used Henderson's 14 basic human needs and nursing research to establish classification of nursing problems. Typology of 21 nursing problems first appeared in patient-centered approaches to nursing and evolved into preparing for nursing research in the 21st century, evolution, methodologies, and challenges. The 21 nursing problems referred to as patient problems and patient outcomes. Introducing the 21 nursing problems theory. 1. To maintain good hygiene and physical comfort. 2. To perform optimal activity, exercise, rest, and sleep. 3. To promote safety through prevention of accident, injury, or other trauma and through the prevention of the spread of infection. 4. To maintain good body mechanics and prevent and correct deformity. 5. To facilitate the maintenance of a supply of oxygen to all body cells. 6. To facilitate the maintenance of a nutrition of all body cells. 7. To facilitate the maintenance of elimination. 8. To facilitate the maintenance of fluid and electrolyte balance. 9. To recognize the physiological responses of the body to disease conditions, pathological, physiological, and compensatory. 10. To facilitate the maintenance of the regulatory mechanism and functions. 11. To facilitate the maintenance of sensory functions. 12. To identify and accept positive and negative expressions, feelings, and reactions. 13. To identify and accept interrelatedness of emotions and organic illness. 14. To facilitate the maintenance of effective verbal and non-verbal communications. 15. To promote interpersonal relationships. 16. To facilitate progress towards achievement and personal spiritual goals. 17. To maintain or create a therapeutic environment. 18. To facilitate awareness of self as an individual with varying physical, emotional, and developmental needs. 19. To accept the optimum possible goals in the light of limitations, physical and emotional. 20. To use community resource as an aid in resolving problems arising from illnesses. 21. To understand the roles of social problems as influencing factors in the cause of illness. Meta-paradigms of Abdellah's 21 nursing problems theory. Nursing. The concept of nursing in this theory is generally grouped into 21 problem areas for nurses to work out their judgment and appropriate care. Abdellah considers nursing to be an all-inclusive service that is based on the disciplines of art and science that serves individuals, sick or well, cope with their health needs. Person. Abdellah classifies the beneficiaries of care as individuals. However, she does not set the standard limits on the nature and essence of human beings. The 21 nursing problems relate with biological, physical, and social aspects of individuals, and can be said to correspond to concepts of importance. Health. In this theory, the concept of health is defined as the center and purpose of nursing services. Abdellah does not give a definition of health. She speaks to a total health needs and a healthy state of mind and body in her description of nursing as a comprehensive service. Environment. The idea of environment is addressed by Abdellah and is included in planning for optimum health on local, state, national, and international levels. However, as Abdellah elaborates her ideas, the apex or core of nursing services is the individual. Hello?
Hello? About the transaction, can I have an update about the status of the transaction?
Unfortunately, we have found a new transaction and we will cancel the previous agreement.
What? No, this can't be happening.
I'm really sorry, but the investors have fully made their decision and we cannot cancel the transaction. Ate, may laro tayo mo. Ate? Ate? Tulong! Tulong! And she is then brought to the hospital.
She needs to undergo surgery not only for her ischemic dry gangrene but also for her ischemic necrosis. While ischemic necrosis may not be curable, but it is possible for treatment to slow the progress of avascular necrosis. So we must inform the patient with this info as soon as possible. And you must convince her that she must undergo the surgery. Okay?
Yes, Doc. Good afternoon, Ma'am. How are you feeling?
I'm doing okay.
That's good, Ma'am. And I am here to inform you that we have diagnosed that it is essential for you to undergo surgery, Ma'am, for you to live well.
But I don't want to.
Ma'am, you really should undergo surgery, and not only for you, but for your child also, who will take care of your child if not you.
Okay, I will.
Scalpel.
After the surgery, the doctor instructed that the patient should stay in the hospital to recover for at least 3 to 5 months. And during the recovery period of 3 months, the patient constantly talks with this nurse, and in doing so eases her time during the period of 3 months. Afterwards, she fully accepted her disease and is willing to go through life after communicating with this nurse. Months have gone by with constant checkup of the patient and 3 months have passed. Afterwards, the nurse also had some issues with stress and is tired, and the patient notices and is later on released from the hospital. But she came back and gave gifts to the nurse, and later on they have a really close friendship that mutually helps each other and mutually benefits.
The following is the nursing process of the given case scenario. Assessment. Middle-aged woman, the fingers became black and malodorous, ischemic dry gangrene due to inefficient blood supply. Severe atherosclerotic peripheral arterial disease. Experience headache, malnutrition, and dehydration. Refused to run more tests. Diagnosis. Ischemic dry gangrene caused the fingers turn black and malodorous. Ischemic dry gangrene also caused the inefficient red blood of patient. Short red blood caused atherosclerotic and peripheral arterial disease. Headache, malnutrition, and dehydration cause the patient into seizures. Planning. Convince the patient to run more lab tests. Give nutritious food and water for the dehydration. Auscultate heart, lab tests for the other symptoms of sickness and checking of vital signs. Implementation. Assess the patient for the different concerns based on the Abdellah'S typology of nursing. Nurses can coordinate and focus nursing actions from observing the problems of the patient. Assist Alexa in her problem and suffering, headaches, malnutrition, and dehydration. Give her assistance in taking her medication for ischemic dry gangrene and headaches. Involve patient into physical activities like exercise to move the body and slowly restore body healing. Recommend proper tests. The rotation of nurses into Alexa's care, the time of medication of Alexa, and the clinical interventions. And lastly, the evaluation. After nursing intervention, Alexa will feel better with the help of nurses, and the help of the nurses resolve problems stated in the Abdellah'S 21 typology of nursing problem.
Nursing acceptance, practice, research, and education. Number 1. Practice. This theory will empower the nurse to give meaning to each and every action that he or she will perform. The 21 nursing problems help the nurse to assess the patient, make nursing diagnosis, and plan interventions. Number 2. Research. Also, this theory could give optimum staffing patterns in terms of researches to acknowledge the patient's needs.
In nursing education, the theory satisfied the absence or limited base of scientific body of knowledge unique to nursing and gave the most crucial and timely opportunity to move away from medical replica of cultivating nurses.
Created using Powtoon.